this module, we'll be going over EMS calls and response. Our objectives here are going to be able to discuss the responsibilities during each portion or phase of the call, as well as explaining different precautions for different types of response and response scenes that you may encounter. So first, we've got phases of our EMS calls. We have 6 phases of each and every EMS call that you go on. The first phase is going to be a preparation. So what we're doing here is making sure that we are ready to go on a call. So this may include things like your vehicle being in good mechanical condition, doing your truck checkoffs, making sure your equipment and your supplies are stocked. Make sure that it is clean and is safe for patient care. There's nothing that's going to fly around, bounce around. Make sure there's no blood or any other icky things that might endanger them or yourself. And then making sure that you're prepared for work, that you're in your proper uniform, you have whatever equipment that you personally will need. The next phase is going to be receiving and responding. So of course we want to be ready for our calls at pretty much all times, and if for some reason we are not going to be able to make a call, it is important to make sure we let dispatch know we're out of service for whatever reason it is. But we want to make sure that we are ready for the calls, that we answer the calls when they come, that we operate the vehicle safely getting there, because if we don't get there safely, then we can't help them. We want to make sure that we find the best way to get there. I know for me, when I was working in a little bit larger city, there were certain roads that we would avoid during certain times of day just because we know, say, a school zone, so there are going to be lots of little kids around, or maybe this one section of interstate always got crowded, and so just different things that in your locality that may make, you might need to plan a little bit different route or alternative route. Always have a backup plan of how to get somewhere in case, say, if there's a train crossing or something like that. Make sure that when you get there that you're finding the best location to park on scene. Now sometimes that's right in front of the house, sometimes it's right in front of the front door, but we need to kind of size it up and see. We've got to make sure that we've got room to get out of the ambulance, that we've got easy way to get the stretcher out, any equipment that we may need, and then actually get around the ambulance to the residence or the scene to get our patient and get them be able to load it up safely. And then of course we're doing our scene size up during this as well. The next phase is going to be your on-scene care and transport preparation. So what we're doing here is continuing that scene size up, because scene size up does not end when you get on scene. It keeps going until you're done with the call. And we're going to do our primary assessment, ABCs, that kind of thing. Then we're going to do our secondary assessment, so we're going to go a little more in depth as needed. Okay, now important to note, sometimes you won't do a secondary assessment on scene. Sometimes you will be doing that during the transport. Then we're going to perform any needed care. So if they need an IV, if they need fluids, if they need D50, whatever the needs are, we perform that care. All right, and then we're going to prepare for transport. Sometimes this means putting them on a stretcher and strapping them in. Sometimes this may mean putting them in a KD or a backboard. Sometimes this may mean, wrapping them up in a blanket because it's cold outside or it's raining outside, and just making sure that whatever we need to do to transport. Also in here is going to be things for some patients, as time allows and as is feasible, locking their doors, getting their purse or their medications, or making sure that a neighbor can watch a kid or an animal, or any little things like that time allows that you can help with that patient can make a real big difference there. Then we're going to be looking at actually transporting the patient. So we need to determine the transport destination. What hospital is most appropriate for this patient at this particular time? Oftentimes the patient may have a particular hospital in mind. They may request a certain hospital, and they certainly have the right to decide what hospital they want to go to within reason. I've worked in places where we had 3 hospitals within a reasonable distance. I've worked in places where we had one that was 5 minutes away, and then 3 or 4 that were about 30-40 minutes away, and then another one that was in the other direction that was available about 30 minutes away. So it was really just a matter of each individual situation and what that patient's needs are and patient wishes are. You're going to select the best way to get there. Now typically this is going to be on the partner, whoever is driving, but you may have some input in it just depending on what the situation is. Then we're going to reassess, and we're going to continue our patient care en route. So this may be doing more of our secondary. This may be kind of the bandaging and things like that. Whatever the patient care needs are, that's what we're going to do on the way to the hospital. Another important part here is going to be communication with the receiving facility. If you ever will see a really mad nurse show up at an ER without having called and warning them that you're coming with a patient, it will not go well for you, I promise. I have literally been on a hospital complex where we got called for an emergency call at one of the on-site clinics that was about a block and a half away from the ER entrance. I called in a patient report, and when she asked what my ETA was, I said, we're coming around the corner. But I still made it a point to call in, even though my transport time was literally less than 2 minutes. So always make sure that you communicate with them. Let them know what you're bringing in, what type of call, and anything in particular related to this call that's important for them to know before you get there. All right, and then sometimes, not always, but sometimes we're going to be documenting our care. Even if you don't have time to complete a full PCR, you should still be doing a portion of a PCR or some variation thereof to give some, so that way you have something to leave with the hospital or some type of information to give to the ER once you get there with the patient. Now obviously, if you were busy taking care of the patient in the hospital, documentation will have to wait until you're done. The next portion of transferring patient care, this is where it's real important here. You transfer care to someone of equal or higher level of medical training. So if you're an advanced EMT, you can transport it to or transfer care to an AEMT, a paramedic, a nurse. If you're a paramedic, it has to be a paramedic or nurse or doctor, something like that. All right, we're going to transfer the report. So the things that are included in this are your assessments, all of your assessments, a scene assessment if applicable to this particular call, anything that the patient told you about this reason that we're here, anything that you did, anything the patient did, and any changes that occurred while with the patient. You also want to make sure to give them or point out any applicable history, allergies, medications, things of that nature. And then you also want to leave a copy of your PCR with the patient. The last section of the EMS calls, or last phase of the EMS call, is going to be terminating call. So this is where we're getting ready for the next patient. So we're going to clean, we're going to disinfect all of our equipment, we're going to replace anything that we used. A lot of hospitals have a trade-out policy with like sheets and pillows and blankets, where you bring one in, you take one out kind of thing. Some places may replace supplies for you. Some areas may have to go back to your station to replace supplies. It just depends on where you work. Then we're going to complete any paperwork. It's important that you complete the paperwork as soon as possible while it's still fresh on your mind, because as time progresses you start forgetting the details, especially if you go on another calls or several calls after that initial one before you complete your paperwork. And of course, let dispatch know you're back in service. Now, as far as types of responses, you will respond to all kinds of places that you never even thought you would end up in. I've gone in airports, I've gone in hotels, I've gone in bank vaults, I've gone on the side of the road, I've gone in a cow pasture, all kinds of different places that you will end up going. So when responding to a residence, you get to see the patient's environment, and that's really kind of a neat and very important aspect that a lot of people overlook. Most of the time, your nurses, your doctors, they don't get to see into the patient's environment. So by us getting to go in there, we get to kind of get a picture, a snapshot of what their environment is, and be able to relay that information to the nurses and to the doctors. Make sure that we are treating the patients, the property, their belongings with care and respect. I've seen people go in and they just start shoving doors around, or not doors, but I've seen people go in, they start shoving chairs around and tables, and things can get broken. So it's real important, balance respect for the property with the urgency that the situation allows. If you do have to gain access into somebody's home by breaking a locked door or window or something of that nature, make sure that you notify supervisors, make sure you notify police, and try to have police there if at all possible. And make sure that you do it with as little damage as possible, and preferably in a way that can be repaired. And then of course, when you leave that residence, make sure that you're leaving that patient's home safe and secure, or as secure as you can. When responding to roadway scenes, this is probably the highest potential for provider injuries and fatalities. I know several years back, I was working and we had just dropped a patient off, and an ambulance came in with a paramedic who had been struck while working on the interstate, and they were working a code on her, and she died. It's a dangerous place. I personally have played Frogger essentially on the interstate, jumping over barriers and medians where people were not paying attention and drove into our accident scenes. It happens. This is why it's so important to pay attention to how you park your vehicle, because you want to try to make sure your scene is protected, because it's much better for them to hit a parked ambulance than it is to hit you when you're outside of that ambulance trying to provide care. Some other things that you want to try to do: position your vehicle where you don't have to cross traffic to get to patients. You don't want to have to be trying to dodge vehicles while you're trying to reach your patient. If you're parking on the side of the road, look in your mirror and look out your window before you open your door, because you're close to the roadway. As some roads have very narrow shoulders, you can open your door into oncoming traffic. So just take a minute, look around, assess your situation. Wear your reflective clothing and or vest. A lot of people, it's required to be on every ambulance, but for some reason a lot of people don't like to wear them. Put them on, wear them. It actually does help people to see you. Now, it won't make people not look or pay attention, but it gives you at least a fighting chance there. And make sure that you're aware of your other hazards. Say for an MVA, if the oil pan or the oil is leaking, oil is super slippery, especially on pavement. Alright, those little sections of road, when the water gets on them, can get really slippery. The old oil will come up sometimes. All kinds of fluids involved. It can just get very, very hazardous. So always pay attention where you're stepping, not to mention broken glass, twisted metal, that kind of stuff. I personally have a couple of scars from answering out to some MVAs. With this, you are trained to the first responder awareness situation. So this is where you're looking, you have to be able to recognize, hey, there's a problem here, I don't need to be involved in it. So recognize possible exposure to toxic chemicals or substances. The whole thumb thing, if you can cover it with your thumb far enough away, we want to make sure that we are indeed truly far enough away if there is any possibility of hazmat. Some of these materials or chemicals can kill you. You really want to show an extraordinary amount of caution when you're dealing with potential hazmat. As far as care to patients who've been exposed to hazardous materials, it can only occur after they've been decontaminated. You cannot fix them, care for them until they've been decontaminated. Otherwise, you become contaminated as well. All right. It's always going to be better to contact the hazmat team. Better be safe than sorry. The last type of response, or major group of response type, is going to be your MCI, or multiple casualty incident. So this is going to involve multiple patients. There is no magic number. It's just more patients than you can handle at that particular time. It's overwhelming to the available resources. So if you're the only truck in the area, a 3-person MVA could overwhelm your resources and be considered an MCI. If you work in a larger city where maybe say there are 20 ambulances, a 3-person wreck is not really that big of a deal. So important things here to remember with the MCI is use the incident command system. You should have already taken the IS 100, 200, 700, 800. If you haven't, you should. Make sure that you're following that incident command structure. Make sure that, if you were first on scene, take command until somebody with equal or higher training shows up to help. Make sure that you participate in any MCI drills if you get the opportunity, training sessions, because it's one of those things, if you don't do it, you don't know how to do it. So you practice it and hope that you never need it, but that way if you ever do, at least you've done it to a degree at some point.